Good morning and a warm welcome to all who have joined us today. Today, we celebrate World Psoriasis Day. World Psoriasis Day is a global healthcare awareness event observed on the 29th of October every year to raise awareness with regards to psoriatic disease and advocate for the individual rights of those who are affected with psoriasis. Today, we have with us our eminent speaker, Dr. Padmasree, lecturer and medical officer, Department of Hydrotherapy, to give us the significance of World Psoriasis Day. Over to you, ma'am. Good morning and a warm welcome to all who have joined us today. Today, we celebrate World Psoriasis Day. World Psoriasis Day is a global healthcare awareness event observed on 29th of October every year to raise awareness with regards to psoriatic disease and advocate for the individual rights of those who are affected with psoriasis. Today, we have with us our eminent speaker, Dr. Padma Shri, lecturer and medical officer, Department of Hydrotherapy, to give us the significance of World Psoriasis Day. Over to you, ma'am.
A very good morning to everyone. I'm very glad that I'm here to talk about World Psoriasis Day on this October 29, 2024. And this year, we have a different theme that is called. Yes, that is about psoriasis and the family. Yes, before going into that, we need to understand what is the meaning of psoriasis. Yes, psoriasis is the word that has been basically came from a Greek word which means itching condition or being itchy. From spora, which means itchy. And iasis is an action or a condition that creates this over the skin. That is called psoriasis. So this has been there for a very long time, and once the psoriasis is affected in particular part, that will be slowly spreading throughout the body. So this condition is little bit more different than any other disease condition. Yes, coming to the theme of 2024, the World Psoriasis Day 2024. On this year, we need to understand the clear difficulties that is facing by the psoriatic patient. It is not only for the psoriatic diseased person, it is also affecting the family. We need to give the awareness to action. So where we need to understand the difficulties which was facing by the family members who has been affected by the condition. We often think that the disease is a burden for the person who has been affected, exclusively on the person who is living with psoriasis for years. But it also have the great impact for the family and how they treat and how they face in the environment where the people having psoriasis. So we need to start this awareness throughout the world, and there are thousands of people who have been affected with the psoriasis and the family members who have been deeply depressed because of the disease. And as Yes, when we talk today on this day, the global community to raise the awareness and call the support for the people living with psoriatic disease, the World Psoriasis Day has been celebrated on this October 29th for more than a decade. Yes, today it has been observed that over 70 countries has been celebrating this World Psoriasis Day, and everywhere the awareness is keep spreading. On each day we are promoting each type of therapy and how to combat these disease. Yes, coming to a psoriasis and who will be getting this disorder. Yes, who is much more affected and who will be having the more prevalence to get this disease. There is nothing called as criteria to get this psoriasis. Anybody can get psoriasis, but it is more common in adults comparing to the children's. It affects equally in both the gender, male and female. So it doesn't mean we have any limitation for the psoriasis. The psoriasis can occur for anyone at any stage of the age. Yes, what is this psoriasis? It is a chronic and it is long lasting disease in which the immune system becomes overactive and it causes the skin cells to multiply very quickly in very fast way. Because of the overreaction of this immune system, it continuously create the patches to the skins which became scaly and inflamed. It is most often seen on the places which has been shown in the picture. As you can see on the scalp, armpit, groins, knee, and in the foot. These are the major parts we can see the psoriatic condition, and this is mainly because of the over and excessive production of this immune system. We have the confusion. Yes, the same like psoriasis, eczema is also a condition where we can see the patches, skin itching will be there. But there is a very differentiation will be there in eczema and psoriasis. We need to understand the symptoms of psoriasis and eczema. When coming to eczema, it gives the intense itching, whereas in psoriasis, the itching will be less severe. Yes, coming to the eczema, you can see the oozing and clustering over the skin where it gets affected. Whereas in psoriasis, it gives the scaling. The excessive dryness of the skin will be seen on the psoriatic condition. Whereas in eczema, we can see over the folds of the body, like behind the knees or in the elbow joint. We can see in the inner side of the joints where the eczema can be seen. Whereas in psoriasis, we will see in the extensor surface of the skin, like over the knee, over the elbow, and above the skin. All the places will be affected in the psoriasis. We need to clearly understand the diagnostic part, then only we will be much more helpful for the treatment of the particular condition. Yes, coming to the types of psoriasis, there are different types of psoriasis where the plague psoriasis is commonly occur in many of the many people. Like around, if psoriasis is detected, 80 to 90 percentage of the people will be affected by this plague psoriasis. This is the most common type and it appears as an raised and red patches of the skin that are clearly covered by the silvery white scale. These patches is usually developed in the symmetrical pattern of the body, tends to appear on the scalp, trunk, limbs, and especially in the elbows and knees. You can see in the picture, it will be occur on the patches and it develop on the surrounding areas. Next, coming to the other type of psoriasis, that is guttate psoriasis. This is typically usual and appears in the children's and young adults comparing to the old age people. So this looks like a small and red dots typically on the torso and on the limbs. This outbreak are often triggered by the upper respiratory tract infection such as strep throat. So you can clearly see in that picture, it is clearly the demarcation shows that these small and red dots, this is one of the other type of psoriasis. Secondarily, we can see after the plague psoriasis. Is coming to pustular psoriasis. This type of psoriasis is pus-filled bumps that is seen in the surface of the skin, which is covered by the red skin appearance. So this is usually affect on the hands, feet, but there is a form that covers most of the body. So the symptoms can be triggered by the medication infection, and stress that clearly creates this pustular psoriasis. So we can clearly see that the skin is covered with the pus that is forming the lumps over the body, which creates the white dots over the entire body. So coming to inverse psoriasis, this is the other form, appears as a smooth and red patches in folds of the skin, such as beneath the breast or in the groins, armpits. Rubbing and sweating can make it most worse because it is present in the folds of the skin, where it is particularly experience more sweating and rubbing rather other comparing to the other places. So when we start itching, or if we touch over the particular part, it will start spreading for the full body. So coming to erythrodermat psoriasis. So this is very rare kind of psoriasis, but this is the secondary and most severe condition when the psoriasis is not treated. If the psoriasis is not treated, this will take to your this erythrodermic psoriasis. It is very rare but severe form of psoriasis, characterized by red, scaly skin over most of the body. It can be triggered by a bad sunburns or taking certain medications like corticosteroids. So this type of psoriasis is often developed in the people who have different type of psoriasis that is not well controlled. So controlling the psoriasis is very, very important. If we are not following any lifestyle modification, diet modification, or controlling the psoriasis, that will take it to a serious condition. So you can see the picture which is clearly showing the erythrodermic psoriasis, which will appear on the entire body. So these are the overall type of the psoriasis, that is plaque psoriasis, psoriasis on the scalp, psoriasis on the nails, psoriasis in the folds, so drop shaped psoriasis, and pustular psoriasis, erythrodermic psoriasis, and psoriatic arthritis. So these is the you from this picture you can clearly notice the difference between the healthy skin and psoriatic skin, where we can clearly see the healthy keratin layer, epidermis, and sweat gland, hair follicles, subcutaneous layer, which is healthy and clear. Whereas in psoriasis, you can clearly see that keratin layer that became scaly white plaques. So that will fly from the body when we dust it. So these plaques will be inflamed in the skin, so that you cannot see the air follicles in that place because of the inflammation on the particular skin layer. So it becomes thicker, and it is very hard to see the your hair follicles. So you can clearly see the difference between the healthy skin and psoriatic skin. The skin will be inflamed, and you can clearly see the scales. And coming to the symptoms of psoriasis, how to identify in the early stage that I'm having psoriasis or not, or anybody close to you is actually having psoriasis or any common skin disease. Yes, you can see the patches of thick and red skin with scaly white patches that is itchy and burn. So this is typically on the elbow, knees, scalp, trunk, palms, and soles. So but on the whole, it commonly starts from the scalp. So you can see the dry, cracky skin and itchy on the joints. So that is the one thing. And second thing, you can see in the nails. So your nails will become thick, rigid, and pitted nails will be seen over the place. And also you will experience the poor sleep quality. Your quality of sleep will be going down because of this itching and other symptoms. Is coming to the clinical manifestation of psoriasis. So we have main four clinical manifestation, that is plaque psoriasis, that is well circumstanced with the scalpy plaques that is less than 0.5 centimeter in diameter to the lesion, and it is generalized disease. Is coming to the scalp. So scalp is, as I said, it is one of the most common site for psoriasis. So anybody who is going to get psoriasis, the initial type of patches will be starting from the scalp. Coming to the nail, can be present without compartment skin plates. So you can see the pitting and hyper keratinosis, oil drop sign, and other crumbling signs will be seen on the nails if the person is having early psoriasis. So the nails involvement is predictor of the psoriatic arthritis. So that is also one of the other critical condition when the psoriasis is not treated. And flexula. So this is classified further according to the anatomic sites, also known as the invasive psoriasis. Well circumstanced, minimum scaly and thin flake localized on the skin folds, that is mainly on the axilla, groin, genital region, that particular folds will be having this infection. And coming to the other few diagnoses and plantar diagnosis, that is mainly located on the hands and soles of the feet, and you can see the redness scaling without obvious plaques, without any patches, but you can see the redness on your hands and feet. So that is also kind of psoriasis. And you can have the acute rupture of the dewdrops. So that is deutata, where we can see the small papula on the trunk or limbs can follow the history of group A psoriatic condition. So you can see that dermatitis and erythroderma, as I said you before, this is generalized erythema that covers around 90% of the body. So it is a little more critical condition comparing to the other psoriatic condition, might be associated with the hypothermia, hypoalbuminemia, electrolyte imbalance, and high output of cardiac failure and life-threatening emergence. So coming to the annular, so that is well demarcated erythromatous scaly plaques with central clearance. So that is also a kind of invasive psoriasis. Coming to pustula. So as we see in the picture before, this is a kind of psoriasis where we see on the pus-filled pumps over the body. So how to identify the severity of this condition? Yes, we have mild, moderate, and severe. So when we have mild, that is less than 3%, the disease will be very minimal and effective on the patient's quality of life. So where we have the high chance of getting recovery from the condition. The patient can achieve an acceptable level of symptomatic control by the routine skincare. So this is a very basic skincare routine measure or topical application will highly helpful in the mild stage of the disease. Whereas coming to the moderate stage, where you can see around 33% to 10% of the body surface area, where the disease that cannot be and would not be expected to be controlled to an acceptable degree. When we identify the disease in mild, if you are not starting your changes of lifestyle or your diet, then this takes to this 10%, where we cannot control these acceptable degree of routine skincare routine is not enough for the patient. We need to extend the work for remove the disease, where we need the extended of the disease with the physical discomfort and location. It will spread to the face, hands, feet, and genitals. And coming to the severe condition, where we can see more than 10% of the body surface area, the disease that cannot be and would not be expect to be satisfactorily controlled by the topical application, and that causes severe patches over the body. So So coming to one of the other stream that causes by the psoriatic is psoriatic arthritis. It occurs in approximately 20% of the individual with psoriasis. So it is more concentration should be shown, not only treating on the skin, but also to normalize these inflammatory factors. So where we have to take the chronic inflammatory arthritis, so that is linked with the psoriatic arthritis. This aggravates the condition, is characterized by potential significant morbidity and compromise the quality of life. As the picture shows, you can see the parts where you can identify the psoriatic arthritis, which is little more severe comparing to the psoriasis. Eye inflammations will be seen, and back pain caused by the inflammation in the spinal cord will be seen, and the nails will be scrambled, and the skin will be scratched with the itchy lesions, and feet and heels will be having the itchy and red skin. So this is one of the condition that is worse than psoriasis. And coming to psoriasis, etiopathogenesis. So main three factors that can cause the psoriasis is gene, immune system, and environment. Is coming to the gene, that is skin specific, innate, and as I told you, gene immune system plays a major role in excessive production. When a parent of any one parent is having psoriasis, the child is having almost 20 percentage of getting psoriatic disease. Where if the both parents, like parents, both mother and father is having psoriasis, then there is 50% chance for the kid to get the psoriasis. So that will be transmitted through the genes. So the disease takes place in genetically predisposed individual carrying one or more psoriasis susceptibility genes. So in which this dysregulated immune response will be there, that occurs and following exposure, like environment triggers which also can lead to psoriasis, that is drug, trauma, smoking, stress, and microorganisms. Yes, immune system, as I told you before, the T cells and dendritic cells are also uh, very much responsible for this cause of disease. All these causes and everything is just the assumption, but till date there is no scientific proof that this person is getting psoriasis because of this. So each and every individual is having a different cause, so there is no particular clear margin or criteria that is having psoriatic condition which will any particular place that can cause the psoriasis. Yes, life with psoriasis. Once the person is affected with psoriasis, how the life will be? Yes, the psoriasis might make you feel isolated. You might believe that no one understands you, but you aren't the first person to get through this. Other people are going through what you are going through right now, and they are driving. So the not only the physical support, not only the medication, the psoriatic people actually need the mental support that have to be given by the environment and the family to support them to come out from the disease, and they should feel that they are not the only person who is having psoriasis, and there are a lot more people having the same condition, and they are fighting against this psoriasis. Yes, coming to yoga and naturopathy, how this helps in psoriasis. We mainly concentrate on the lifestyle modification. So lifestyle interventions plays a very big place on the cure of psoriasis. Not only psoriasis, for every condition we have this pragmatic, holistic, multicentric approach that is aimed at improving the clinical outcome of psoriasis and it's associated with any other conditions. So we do all the particular normal work into a connected systematic way. Yes, in addition to our naturopathy and yoga system, we also focus on the betterment of quality of life. So quality of life is very, very important thing that they have to improve after taking the treatment. So the self perspective well-being of the patient is also important. So the patient should believe that the treatment is working and they will completely recover from the particular condition. So this treatment also focus on the betterment of the quality of life. Yes, coming to our protocol, what we do for psoriatic people once they come to us. We generally go to our protocol where we start from the hydrotherapy, that is water treatment that you can see gives the temperature difference. As I told you in the symptom, there will be hypothermic state where the patient will experience. This hydrotherapy will help them to come back to their normal temperature and helps in their nourishment of the skin. And coming to the massage, yes, massages, we have different types of massage for the condition, and that is highly helpful for the patient to come out of this disease. So coming to the tropical application, we generally go for this rice fortification starch and mud therapy for the skin. We directly give application for the entire body, so that will treat the skin, hair follicles, and also it helps in anti-inflammatory property, so that they can come out of the disease. And coming to the therapeutic fasting, will make the patient to fast, and the calorie intake range from 500 to 100 kilocalorie, that helps the patient to reduce and maintain the healthy weight. So that plays a very important role in managing the disease. Coming to acupuncture, we have acupuncture, acupressure, Reiki, pranic healing. Everything is very essential for this condition. So the acupuncture, the points will give the maintain the inflammatory factors and reduce the inflammation of the body. We also helpful in the skin scaly patches, that also will be removed. Coming to the yoga therapy, yes, we have a particular yoga therapy technique that highly helpful for the patient to normalize their mental health, their physical health, and it helps in the helps for the patient to maintain their regular work without stress. So stress is a bigger factor that can cause to the disease. So the therapies will help will given for the patient on the regular basis. Though we have the general protocol for all the patient, we treat patient individually, as the therapies will be prescribed by the physician on the daily basis after assessing the patient response, in which therapy the patient is highly getting recovery. Based on the patient response prognosis, the physician or naturopathy physician will be giving the treatment based on the condition. Is coming to naturopathic therapy. So what we do in naturopathy? So we mainly promote the self-healing capacity of the body. So the yogic principles of blending the disturbance of mind were considered as a primary therapeutic goals. This naturopathic therapy promotes the self-healing. It helps, we as a doctor, helps the patient to clear out the mind that they are not actually having a very big disorder, that they are definitely in the healing process, and how the healing process, how to handle the stress during this healing process. We as a naturopath and helping the patient each and every day, we helps the patient to remove the negative thoughts from their mind. So that greatly supports the patient to come out of the disease. is coming to the 6 basic principles that we follow in yoga and naturopathic medicine, that is healing power of nature. We strongly believe that nature has the healing power, and we don't have any other external things to put inside before believing in the nature. And next, coming to the identification and treat the cause. So, not only treating the disease, we need to treat the cause that helps the patient not to get the disease back, so that it is a permanent cure. So, coming to another point, that is first, do no harm. So, we need to understand even the step by step consistency should be towards healing crisis. There should not be any single treatment or single therapy that should not demotivate or get back the disease worse. The every treatment and every consultation, counseling, everything will takes any 1 or 2 steps above the disease towards the healing process. And we act as not only as doctor, we also act as a teacher. As a teacher, we teach the patient to maintain the healthy lifestyle, to maintain the healthy dietary modification. We teach them what to do, what they have to avoid, what they have to regularly take, and how their entire day should be planned. So treat the whole person. It is not like a particular patch or particular place where the patches has been seen should be treated. We have to concentrate on treating the entire body, entire system of the uh, human body. And next, we will start the prevention. Not only treatment will not give the permanent cure. Prevention is very important factor that helps in helps not to get the not to get the disease again. These are the some few helpful factors apart from naturopathy and yoga. As a home remedy, sometimes we can go for this tropical application, that is cream, ointments, lotion, foams, or any solution especially containing the corticosteroids, or commonly used to treat patient with mild to moderate severity. And other tropical therapies including vitamin D based medicine, coal tar, and other vitamin A related tablets, supplements, and some inhibitors and medication can be given to reduce the excessive itching for the particular period of time. But this is not the complete solution for psoriasis. And other medications also can be given. So anti-metabolites can be given as oral or injected form to suppress the immune system. Once the immune system is getting suppressed, the multiplication of cells, cell growth will be slows down, so that the itchy and the scaly skin will not be seen. So oral retinoids is a compound that is relating to the vitamin A, which is very essential for the patient. So some people with moderate to severe psoriasis can use the phototherapy, which is little more advanced than taking the regular supplements or tropical application. So those who can't handle with this state, they can go for this phototherapy. What else we have to do in the home? The person who is having this early psoriasis have to maintain the skin well moistured. After a bath in a lukewarm water, a mild soap should be used with no more flavors or any other oils. We have to take the bath in lukewarm water and use mild soap that has added oils. And after a bath, the skin should be applied with a heavy moisturizer. The skin should not be left as dry. So this moisturizing skin will helps the patient to overcome the disease. And what is the criteria we have to maintain? As a psoriatic patient, the patient should maintain the healthy weight. The obesity makes the symptoms of psoriasis worse. So making the diet is very, very important. So the Mediterranean diet that has been shown to be helpful in several psoriatic studies. So that will be helpful in reducing the condition. So coming to the increase of vitamin D that is contributing to the patient to improve the prognosis. A growing body of literature. So this pathogenesis of psoriasis through and progress with upregulation of the cutaneous immune system. So this will be downregulation of pro-inflammatory cytokines, enhances the antimicrobial peptides expression and preservation of the skin barriers eternity. So vitamin D is playing the very, very important role in curing the psoriasis. Not only vitamin D. Coming to vitamin B12. Both vitamin D and B12 both plays a very, very important role in the inflammatory factor, has been shown to protect more of the cells from the inflammatory oxidative stress. And however, this vitamin B12 deficiency is common presentation in psoriatic patient due to multiple factors like increased utilization of vitamin B12 in the skin and poor absorption from the intestine, and also due to the elevation of plasma homocysteine. And this is all about the management and how to live with psoriasis. And on this day where 70 countries are celebrating this worldwide psoriasis day to normalize and give awareness for the patient who are having psoriasis, and we as a public should give the strength for both the patient and for their family to overcome the disease. Thank you so much. And if you have any question, please do contact us through the address given. So we are always welcoming all kind of diseases, not only psoriasis. We are ready to give the holistic approach for any condition. So as a family of JSS Nature Cure and Yoga Hospital, which is located in Palakkad Highway, Navakarai, Coimbatore, we are happy to invite all the patient, and you can stay here, take all the therapies which I have shown, which will be greatly helpful for you to overcome the disease. Thank you so much.
By this, we come to an end of the session. I would like to thank our speaker, Dr. Padmasree, for not only sharing the invaluable time, but also enlightening us with a commendable talk on the subject. Thank you for enhancing understanding pertaining to psoriasis. I would also like to thank the management, principal, and all the faculties for the valuable support. I extend my heartfelt gratitude to each and everyone who has taken part in this webinar. We declare this webinar is closed. Thank you, one and all.